Good afternoon. I would like to welcome everyone to our work session on November 21st, 2016. The first item on the agenda is a discussion of the fire service agreement and a presentation by Dr. Cohen from TriData. Before we start, I would like to welcome the Director of Administration for the county, Mr. Wayne Strasberg. Thank you for joining us. Come on up, please.
Good afternoon, Council President, members of the Council. I'd like to thank everybody for allowing TriData to participate in this study and also to make this presentation before you today. It's been a long time coming. There's been a lot of hard work done. And as I've said at the other two meetings, and we'll put on the record for this meeting, and that is that I'd first like to thank and congratulate everybody from both the city and the county, from all the organizations that have participated in this endeavor. I know that some people were more supportive than others. Some vehemently opposed what we tried to do, but I can assure each of you that everyone who participated was very professional and even through the emotions of it, let this happen. And allowed us to get to this point today. And I think that, I can't say enough about that, especially even those who had some real doubts and concerns about this. And I wanted to get that, Council President, on the record for you, both for the county participants and the city participants. What we'll go through here is where we are right now and what we've come up with in the evaluation of the fire service system that we were asked to do. What you'll find out when we're all done here is that while we have very specific problems we were asked to take care of, you'll find out that some of the answers are very general and are very just problem solving and leadership and advocacy in nature. And you could put any technical problem within here. But what we were really asked to do is talk about 3,620 EMS responses and 1,330 responses that the City of Salisbury Fire and EMS respond into the county as first due, i.e. the closest available emergency units. That's what we had to focus on here today. And obviously understanding that there's history behind this like there is with everything in government. And we tried to focus on where the problem is at and not who the problem is, and the solutions that we're here to offer. It's easy for us to do that because we get to walk away. And hopefully we are leaving you with something that you can do. As I've mentioned in both of our meetings today, if you accept nothing of what I say here, the one thing that is absolutely necessary is the modernization and centralization of a data source within the county. One data system that's considered the true, this is what we all agree are the numbers, and that there's data integrity and security, but also accessibility from those who are authorized and need that accessibility, and that any type of changes at the dispatch level can eventually be easily aligned with GIS or any type of predictive software that you want to use, and also, again, accessible by those who have the need and the authority to do that. Without that is step one. Without that, anything that I can suggest to you, I would also have to tell you that it will probably not be successful if we're not moving in that direction. Centralized data is really the alpha through omega of fire and emergency medical services. We have standard definitions, we have standard times, standard expectations, and that the data is available that talks about not only the dispatch data, but eventually moving into storage of the EMS reports and the national fire reports, which all of our departments between the city and the county are doing right now. just for the purpose of this meeting, and there's nothing here that, this is not an official definition. For explanation purposes, anytime we talk about urban, we're talking about the city of Salisbury. Anything suburban are these 4 areas. A lot of those areas, the city provides primary response for emergency medical services and firefighting. And everything else we'll call rural. A number of the times needed to analyze things very clearly were really not available. Now, this is nobody's fault. We tried to get them, and the current technology really doesn't allow for them. And there's never in the past been an expectation from the 911 center for the level of detail that you're going to start to need to really get down to what we're doing here and what we're suggesting. And anytime you are dealing with a manual entry of data, errors are likely to occur versus those systems where a push button that will automatically enter data and will get you the real data. There are times now where times are produced and the dispatchers are doing something else, maybe even more critical, like getting units dispatched, etc. So we really need to take a look at that when we look at everything. Now, response times. Basically, we are talking here about the time that the 911 operator picks up the call at the 911 center and the time someone is on the scene. We do not use average response times. Average response times tell you nothing. I would not want to put my job on the line trying to explain averages, just like your positions you don't want to put on the line talking to people about averages. They really don't say anything. 90th percentile, I'm more comfortable talking to people and saying 90% of the time that's what you're going to get. And I'm very clear about that and not trying to hide anything. The response times are a little long. Now, here's the problem. I don't know why. I don't know where it's happening. Is it the 911 center? Is it the amount of time it takes for a unit to get a crew and get out the door? Is the response time the same for the city when it's full career daytime, and once it transfers over to volunteers in the evening at 2 of the 3 stations? Is that where a change occurs? And we don't have that level of detail right now. And it's something an upgrade would do. And as you know, the farther out you are, the longer those response times are, and that's kind of obvious. And I'm looking here by different stations to see, is there a real wide variation? Is one station very long? Is one station very short? And the answer is basically within the city and the suburban areas, no, there's not a great deal of time. When we talk about the specific problem, everybody, there's a couple of other definitions. When we talk about automatic aid, we need to consider that as any time the city is dispatched across boundaries as part of a pre-assigned agreement, that dispatch knows, and you all know, that in that part of the county, as Wayne would like to call the donut hole, Salisbury handles that first. Mutual aid is any time for the farther responses that the city is specifically requested, or the city specifically needs the county to come in. We know that those automatic aid calls are increasing. It's very predictable because that's where the activity center tends to be increasing. And you'll see what I mean as we go further. We also studied very closely the problem of mutual aid calls. How much is coming into the city? How much goes out of the city into those outside areas? And the bottom line answer, everybody, is it's a wash. The calls into the city are increasing, but the calls outside are increasing slightly, but it's a wash. It is not affecting anybody any more than the others One of the things we have a problem with is, are the numbers we're seeing incident numbers or unit numbers, i.e. a unit number would be assigned for each piece of equipment. And the 911 center is having some trouble with that. Eventually, we got to the point where between the 911 center and myself, we just had to call it a measurement and put this report out. But some of that is still there. When we looked at our predictions over the next few years, one of the years, some of the percentages have gone down. And I think that's questionable because it skews the mathematical predictions. We use two mathematical models, basically, and without going into it, one is basically linear. It looks kind of like a curve, while the other is more like a slant. With that, we came up with high and low models throughout here. All data is provided by the 911 center, and we are striving. One of the things, as we said, is to recommend that is just a critical point to this. One centralized center where the leadership of the city and county, the leadership of fire and emergency medical services has said, we accept this. We're all buying into it. We all have confidence there. Some of the high-low projection models here basically talk about each station, where we think the activity can be or won't be. And if you look at it for the city of Salisbury, we see a modest increase continuing to occur over the next several years. Again, somewhere in between there. You can't take it dead center. If you look at the suburban areas, we think they're relatively stable. We had a question about the numbers in Hebron, and it's the way the math came out, but I agree with those people who say, I'm not sure about that. And as you see the wider swings in the rural areas, and the reason being a difference of one call when you have 200 total and one call when you have 4,000 total makes a very wide swing here. But when it all comes out, those areas tend to be relatively stable over the next few years. Don't ever shortchange small increases, though, because if you talk about 10 or 11,000 calls, just like with your EMS response out of the city, you start talking about 2%, and you add a couple years and you compound it on, and suddenly you are significantly busier. And you wake up one day and say that 2% a year, you wake up and it's now 10%. Maybe an altogether different situation. For fire high-low projections, now you may take a look and say, wow, do we have a fire problem in the city of Salisbury? And the answer is absolutely not. What we believe is these additional calls are for EMS first response and for EMS assistance on critical emergencies. If it's a piece of fire equipment, we were unable to break that down further. But I'm pretty assured that that's the reason for these numbers. And again, more in the suburban areas, little bit more stable. We may see some more peaks in the rural areas, especially, and you never know with the weather and field and woods fire seasons, with the wildland interface, where that's going to go to. But just looking at history, plus the EMS response in those areas. Again, we didn't get all the detail that we needed or would have made things even more precise. And it's nobody. I'm not sure we have it ready to be used because it's never been demanded before. And this is not just the city, this is the city units, the county. Some of the volunteer companies aren't ready to part with data to strangers. And we understand that, and hopefully you'll see later how we're trying to get some of this. One of the things we do have to realize, though, and it would be unfair not to, is some of the support that's given to the rural and suburban areas, basically for maybe a quarter of the calls run by some of the city units, they pay the same amount for fire engines and truck companies and all those things. They don't get discounts based on how much. An engine company is starting to get close to 800,000, maybe even even more. Truck companies over $1 million. They have to pay just as much as you do for your city services. So there needs to be some standard level here. And also, obvious, when you look at costs, career services will experience a higher cost because 90% of the cost is human resources. And you'll start to see, though, that the costs aren't horrendously different when you look at that. And here's the cost for EMS calls. Again, personnel costs make the city a little bit more. I think if we redo this in 3 to 5 years, you're going to see those costs start to come together because more of the county units are hiring paid people to part-time and even full-time for these responses. And again, in the rural areas, that they respond to fewer calls, so their call price is going to be higher. Got to use the same equipment, same standard to do that.
Could I stop you there for one
You
second?
may.
I understand that, if you look at it, straight number. But by the same token, is it not a fact that the fire equipment, based on the usage, the more calls you have, the faster you're going to have to replace that piece of equipment, because as opposed to a department that only has 50-something, 60 calls a year.
I think that I've done some work with that for very large fire and EMS agencies, and the use of the equipment, the number of calls, comparing those to maintenance costs, aren't exactly what you think would be logical. And the other issue is that if you are in an area where the maintenance is much better on those faster running units, it may negate some of that wear and tear, where if you're in an area where it's not maintained well, they're going to run down even quicker. In some of the faster areas where you have appointed drivers, 3 or 4 people who always drive, and that's all they do, instead of perhaps in an area where there are 10, 15 people, you're going to have less wear and tear because the braking tends to be closer and the wider range. So there's so many variables in that. I don't think we can come up with a direct answer with that. If you look at the cost per call, and you see in the parentheses, does it really mean rural they're getting $52 too much based on what's provided them? I wouldn't go that far. It was based on the figures that we got, and I guess if I was a volunteer chief, I would say good management, but it's just a preliminary thing that we came up with, and many are always concerned we're not getting enough donated to us, and that has to be looked at a little bit harder. One of the things, and the main thing we tried to come up with, is what is the EMS cost deficit for the city? You're running about a third of your calls out, EMS calls that is, outside of your prescribed area, because you're the closest unit. And as you'll see later, the option of the county opening up new volunteer stations closer to the city line, et cetera, thinking is just not what you need to do, especially with the troubles that are occurring with the volunteers. And there have been several articles recently about Wycomico County and the city of Salisbury published concerning the challenge of volunteer fire and EMS. And we know across the country that we lose about 8% of our volunteers every decade. Doesn't sound like a lot, but as we sit and talk during our lifetime involvement in public service and public safety, the volunteer service is about a quarter less than when you started. That's big. And so we need to put that into perspective. We believe after adding up all the reimbursements, charges, et cetera, that there's an unrealized gap of $193 per call that the city is not reimbursed for. So we're going to start, and I'm going to quickly work off of that and start to talk about some options based on that. No matter what, hopefully a consensus it will be reached. And while everything we do isn't easy, and that's why we're all here to do the hard stuff, in this situation for right now, trying to do it as easy as possible is probably the way to get the reimbursement pattern started. And also what we'll talk about, and that is getting consensus between city and county, volunteer and career services, et cetera. I think will yield a whole lot here. We believe that you spend between this much, and a lot of that gap, that variation depends on whether you transport a person or you don't transport a person. Now,
should that say fire EMS service to the county? Yes.
Yes, it should. Thank you.
Gotcha.
One of the things that's not in your report, and I've been reviewing this, is since a majority of your calls when you put it together are Medicare and Medicaid versus others, there are some very strict CMS regulations concerning anti-kickback violations about passing money back and forth. They're not as strict as they were for a while, but I will also say anything that you decide, whether it's one of the models that we suggest, or it's a model that you all come up with, a variation on the theme, that your legal people at least review this, and CMS will provide an anonymous, non-specific review. They won't do it for me. I have no standing. I can't call and say I'm doing something for the city of Salisbury. They won't do that. It has to come from either the city or the county. And I'll work with you all with that. I can work with everybody on this. But if you feel it's necessary, and your council feels it's necessary, again, the anti-kickback issues are very strict, and they're actually stricter for ambulance services than they are for physician and therapeutic reimbursement here. In this first model, very straightforward, $193 per call that involves patient transport. Like anything else, folks, if it looks easy, too easy, probably is, and there's something behind this. Usually, non-transports are usually not reimbursed by most insurance providers except for very narrow circumstances. This is slowly changing, but don't wait for it. It's going to be very slow for CMS before CMS, Center for Medicare Services, will actually make this nationwide. Then the question becomes, is that fair? Even if you can't submit for insurance, you do when you just go out the doorway, you do expend services, or if you treat and release patients, logic says, I should pay you more money because we're not involving them in the healthcare system. But our 1960s model of EMS reimbursement is totally counterintuitive and has stuck us involved with EMS with this. It's slowly changing. That's all I'll say about it. In this situation, the city of Salisbury would retain control of the finances. That means not only will you get reimbursed, but you'll go after the money for collection. That's one idea. The risk is on the city completely. The next area looks at it in the other direction, and that's the deep discounting model. There are those governments and those EMS agencies, and one of them that uses this, and that's where I got the figure from, but it's any figure that you all decide to come up with, is on the west coast of Florida, where they're contracted to a private service for the transportation, is that the one agency, the county, would just pay a flat rate to the city. The city would say, hands off, I accept this, I don't need to deal with it, let the county figure out how they're going to collect the rest of it. The county would gain financial control, the city would reduce their risk. Again, there's pros and cons to that whole thing. It looks like, wow, that's easy. It really isn't. You've got to be sure of what you're doing and how much is that risk benefit that you would be giving up. And a model somewhere in the middle ground would be something like this, where it's close to the first model. However, the county would pay a little bit for each transport or non-transport. The city assumes the financial risk, but not as much. The county says, city, this is your call, do what you can, and that's the collection in addition to what you would normally collect. Again, these are the three things to start with. Variations on the theme, folks, are there. Fire is a little bit more straightforward, and that is, we're talking about $288.95 per call, regardless of time, type of service, etc. And you should be reimbursed at least this much. Now, we're getting into something, and that is the ability of city and county chief officers to work with each other. Right now, these are general figures. Are they too little? Are they too much? I think they're close. But by both agencies working on standards, saying for this type of emergency, this is what we will pay for. Chief, if you want to run more pieces of equipment, you're the chief. I'm not going to question that person operationally, but the stewardship is also needed there. And that's there. And again, it's secondary to good patient care and good fire and EMS service. But our chief officers are being expected to show greater stewardship within running their departments. And it also helps to do what seems to be somewhat elusive, and that is having a standard for the area. So it kind of does both of these things here. Based on our scope of the work, we came up with 10 basic recommendations, some I've talked to you about. Recommendations 1 and 2 have to do with data and accuracy, and again, if you throw this whole thing out the window, that's the thing you need to listen to, because whichever direction you go in, data accuracy is going to be, have to be a basis, whether it's evidence-based medicine or using evidence when we talk about fire fighting, when we talk about justifying not only your fire engines, but your community risk reduction plans. And just an example of that is, I would hope, eventually, not only do you talk about how much fire loss there is, but how much fire save that your people made, and that the chief can look and say, for all of our commercial establishments where there were fire emergencies, if you were inspected and you took care of your errors, none of those buildings caught fire this year. All of our commercial fires were in uninspected or failed inspections. Boy, that goes a long way to say what you're doing. And that's going to be needed as others compete for more of the public money that you have to decide to dole out. The next recommendation concerns the fixed grant provided to each volunteer company. At this time, that needs to continue because of what we had explained. We need to have more information, not just for audit reasons, that's part of it, and we're not recommending formal audit of each of the volunteer companies at this point. But I know the Director of Finance is interested in working with all of the fire departments, and I know City Finance would be, into saying, can we focus in on where we're spending? Are we getting return on investment, et cetera? And again, especially when you're going to be billing another agency for your services and things like that, I think they can do that. We do not recommend any new volunteer companies. Initially, we do not recommend any new big pieces of equipment in either the county or the city, with one exception, and that is the city of Salisbury will likely need another ambulance very shortly, as the number of calls are increasing to where it will stress the speed and the quality of service. And I've talked with the chief about that pretty much in depth, and I know he's on top of it. The next one is that area of the donut hole. There's some issues about, are they charged as city or non-city residents since they have no choice. Basically, we have, since they're in your first due, I believe they need to be called city residents. The chief and I have talked about this, and that is something that can be negotiated in your fire service agreement between the county. There. So we talked about choosing one of the models or an offshoot. We talked in our initial meeting about some of the numbers. Should it be 193? Why not 192? Et cetera. And I think as much as the numbers are important, based on history, what I've seen, the mere fact that everybody can get together and the responsible agencies can agree with each other, that will be just as beneficial as the exact dollar amount you're going to get, because it's that agreement that is going to be absolutely necessary for the future, and it will change the way. That will be the real change. The numbers, the money, while important, is the technical stuff. It's the fact that the leadership, both governmental leadership and our fire and EMS leadership, have made the determination that showing leadership means doing that. That will be there. I come upon this purposefully naive, understanding what history is, but not giving up on the talent that you have here in this community. So that's that one. We have just a couple more. Recommendation 8, this is for fire. And one of the things that we put into this is a rather elaborate monitoring system between the city fire chief and the county fire chiefs. And Chief Hoppus commented on that, and I have to agree with his comments that we just need to streamline that a little bit. Sometimes we can be so transparent and so much, have so much kinship that we do things we don't really need to do. And I have to agree with his comment on that. If we're positive about everybody doing that. Again, the next recommendation is, since these are going to be new ventures, or ventures where both the county leadership and the city leadership are going to tell their public safety personnel, this is what we expect from you. This is what being a chief is, whether it's career or volunteer. And what I have to say there is that sometimes you need some help getting agreements, learning how to reach agreement, especially if that's not been anyone's specialty in the past here in fire and EMS. And again, our services are there. It's not as important as who does it, as it's somebody who the people are comfortable with and will work with. And also, we believe that a comprehensive assessment is needed between the city and with the city and the county fire and EMS service. If you want to really look into the future and say, where are we going? What will this look like in just a couple years or even semi-long term? I want to end with one thing that I've told each of the meetings before, and that is, nobody's told me this, but I don't have to be really a genius to understand it. And I've told the leadership of the county and the city services that I believe, consciously or not, that how they handle this problem is being monitored, and that their political leadership, as they look into the future on what the needs are looking to see that the leadership in every part of the organization is the leadership that's needed to achieve these things. So again, the specific agreement isn't quite as important for the future as the agreement. That the group can say, yes, we all think this is the way to go. That's where I'll conclude my presentation. And I would like to ask, through the chair, if you would allow me to take questions.
Absolutely.
Just a couple more things. We talked about all this. Stuff here. Yes, we've done most of this. We covered the rest of this. There's no need for me to do it again. Here. Thank you.
Okay. Questions? Okay. Go ahead.
No, you go ahead.
The way that I read your recommendations is I sort of went through them and sort of made a line. Wycomico County should keep accurate records of all response times involving 911. That's them. They've got to do that. They've got to do that. Recommendation 2 was dispatching protocols. I was less worried about the accurate time measurements than I was about what goes out of the firehouse from the city. Is it a fire truck and an ambulance? Is it 2 fire trucks and an ambulance? You suggested, and I'm not sure whether or not you meant to do this or I heard it wrong, does the 911 center decide if an ambulance is going out with the fire truck, or it's the other way around? The fire truck is going out with the ambulance?
A qualified yes. And what basically happens is, if these are accepted, that they use a standard, medical priority dispatch, fire priority dispatch, which makes a recommendation. Before that, the city fire chief and the county fire chiefs would affirm or modify those recommendations. The 911 center would follow their protocol-based instructions.
Do they have
That's it.
protocol-based instructions now?
They're getting there. Not as detailed as they should be. And this is, this is what's going to help the county. If they have these standards, consensus standards, they'll be able to direct exactly what equipment is needed and what they have to pay for.
Okay. Your recommendation number 3 says the county should continue to provide a fixed equal financial grant for each fire company, and I don't think there's anybody in the room who disagrees with that, regardless of what is out there in the internets and the rest of it. No one in the room has ever said that fire companies that are not in Salisbury should be getting their money. So I just want to say that out loud for the 5,000th time in the hopes that someone hears that.
Thank you.
Recommendation number 4 says the county fire chief should work with the county director of finance to create an annual report. That's on the county. So I'm just going through them. No new volunteers should be formed to respond to the county. That's not us. That's somebody else. We wouldn't have the ability to do that. County residents who are served first due by the city of Salisbury should not be charged. That's okay if there's money coming back from the county
Part
to
of
make up the
negotiating the
difference.
agreement.
Right. So I'm trying, and if the council president, if we have any other direction that we're supposed to be going in, but I did your $193 per EMS call, and I multiplied it by the 3620, and that's $698,660. And I did your $288 for the fire call, and that's $383,040 for a total of $1,081,700. I'm not sure whether or not we're going to be accepting half a loaf if we don't reach the numbers that have been given to us by the fire chief previously. But those numbers are a start. I want to say that, and I appreciate you giving us a start, because you have reaffirmed what I think we knew 18 months ago and 18 years ago, that there is an inequality in the service, in the payment of the service. Several times in your larger presentation, you say that the fire chiefs would need to get together with 911 and agree on the number of calls, and then take that to and as you wrote it, take that to the county finance director for payment. So once they agree on that this was the number of calls that you did, this was the number of calls that I did. Ambulance went with it, ambulance didn't go with it. Then we get that number, we take your two suggested numbers of the inequality, and we go. And we go to the finance director for payment to the city of the difference.
Okay.
That being said, let me go back to, because this is the one I used to write all the rest of my questions down. Several times you say, and I'm not sure about the syntax, so I'm just going to ask you the question,
Please.
that you didn't have enough information.
Correct.
Where did you not have enough information?
What we did not have enough information with is talking, when we went to measuring response times and things like that. Also, we had to look at what everybody submitted budget-wise. Some submitted more than the others.
Right.
Some of the county units basically said it's really none of your business. And some of the city's detail was a little less than there. And it just put us in the position to say we have to just analyze based on what we have. I think we're very close, but it's not as specific as I would like to see it. I think once the dispatch center gets modernized, it will be. And if you allow me, Councilman, when you say that there's certain things that are not on your plate, that's the county's problem, I guess I would have to also say you don't want them to make it your problem, though. If they don't modernize software in the 911 center, it's going to mean
No,
you
it's
may
gonna
have,
affect
you
police
may
and
have
fire.
a problem that somebody else caused you, and we're trying to get
Do you
those
have any
ahead of
idea
time.
how much that upgrade to the 911 center would be?
No,
We just
because
upgraded to the tune of $1.4 million radios so that we can connect with the county, both with fire and
Absolutely.
police. So my question is,
20 million, I think is the number.
is the number?
Radio system's 20 million.
and you know, here again, what we've urged and we talked to the county about is this is where the leadership of the county and city, especially your fire and EMS leadership, before anything is done, has anybody made a list of this is what we want our 911 system to do?
Okay. All right, well,
Here
then,
you go.
then my
Show me how you
then my
wanna do it.
question is this, for the sake of the 18 months and the 18 years, what I don't want to see is someone say to us, I'm sorry, we can't do this for you because we have a $20 million 911 center thing that has to be redone. I don't want to put you on the spot. How close do you think your numbers are to real? 50%, 60%, 70%?
I think we're pretty close. It's there because, and I have to.
I
tell
would
you-
write incomplete on your paper if you were one of my students.
Well, and you know, being
that's
a
okay.
college professor myself,
Yeah.
if one of my dissertation students gave me that answer, I would
Right.
put the same comments down as you would, Councilman. However, based on what we have, that's what I need to tell you. Hopefully, if we talk with each other in a year or 2 years from now, that would be corrected. And we would be a little bit closer. Again, we used the Medicare and Medicaid reimbursement levels. If you buy into the concept of what we're doing, we would go to the person who's currently collecting your bills and say, give us a very precise cost number. Even though most are using the Medicare guidelines, we would ask how many from military health care, how many from Aetna, how many from here.
I
And that would
appreciate
get us
that,
more
but to me,
precise.
either the fire truck and the ambulance go out of the building or they don't. So the last couple of
If you
questions I have
talk
for you.
about precision, that's what I
Right.
can tell you.
On your last page, you said,
Mhm.
after completion of the above, the county and the city should contract for a comprehensive assessment of fire and EMS services
Mm-hmm.
in Wycomico County. And I'm just asking this question.
Includes the city.
I thought that's what you were supposed to do.
That was not our scope of work was not a comprehensive assessment. For example, I was not,
I think I said back in the day, if we don't get information that we didn't already know, do we get our money back?
well, and there's a difference, a lot of what we do in life as consultants is tell people what they do already know, but we're afraid to say. Because I can get away with saying it because I get to go home.
So when you
But
do a
also-
comprehensive, what's a comprehensive assessment look
It
like?
would look at the whole system it would delve very deeply into response times, which areas specifically, which time of the day that they're getting services. It would look at training. We would look at all the stations, both career and volunteer, city and county, and say, without an architectural assessment, but we can say there are some very, very significant problems in this station. We believe there's going to need major repair in the next 5 years, 25 years. We would look and say, what about the future of volunteerism in the city of Salisbury? Where do we think that's going? What are some ideas? Should the county go to a paid EMS system and let fire do fire? That's all part of a comprehensive evaluation.
So let me ask you this question. Do you think that the fire chiefs could look at the numbers that you have provided here, which you did your level best to get as much information, and agree? I'm trying to figure out how they would be wrong. Either the truck went out of the house and the ambulance went out of the house in the county or in any of the other fire stations, or it didn't. If the discrepancy comes down to is what equipment went out, then is there a cost for non-ambulance going or non-fire truck going or fire truck being there or not? In an effort to move this process forward, if we have the numbers that you have, is our next step going to the mediation that you suggest and saying, these are the costs that you came up with? Or do you believe, let me just ask you this question this way, do you believe we go to mediation and it will be, well, the 911 center needs to be upgraded, or you didn't have enough information out of this? I'm trying to figure out where the
Okay.
stumbling block
Very-
is for the check.
The stumbling block for the check, Councilman, is getting both groups together, whatever number they come up with, and saying, we all agree, let's move forward.
So if
We're
we
gonna
could
stop
get them
arguing.
to agree to your cost assessment, and they agree to the number of calls, or vice versa, or all of those things at the same time, we may be well on our way to.
Yes.
Is it your recommendation to us that we wait till the 911 center has been redone before we continue moving forward?
Absolutely not. Because, and the reason being is everybody starts to wait for this next pie in the sky thing. Oh, it's going to happen, it's going to happen. And you may be off by a couple years.
I would separate the 911 center and the fire service agreement because the 911 center, as county taxpayers, we pay a full share county tax, and that's due us as county taxpayers.
And I would do the same
Thi-
thing. I'm
this
just
is a
wondering
s-
if there are other people who would not.
Well, this was brought up at 2 o'clock as well.
Right.
And so it's, there's, that issue, the tax differential and issue, they're three separate issues. This one is specifically about city taxpayers subsidizing fire coverage to county residents who do not pay city tax. We do get some funds from the county, but it does not, there's a gap. And so, you know, our focus is the gap and filling that up.
The only other question I have, Mr. Heath, and if you'll come back to me later on if I have any more, was the use of the wildland interface. What is that?
Well,
Brush fires.
yeah.
Is that brush fires?
Yes.
Okay.
Happening
Brush
where,
and wood.
Us city kids sometimes don't know about this.
Well, you should get
well-
out more.
well, that's it, as the urban suburban areas touch those rural areas more. And, you know, just your trivia for today, one of the biggest things across the country is the increase in snake bites, because people are now moving into areas that are urban suburban that have been rural.
Right.
And they didn't tell the snakes, they don't tell the deer, they don't tell anybody else that they're going to do that. You just do that. And that's your trivia for today. Thank you, sir.
Okay.
Thank you,
I
Mr.
would
Heath.
I would just like to say that I attended the county meeting this afternoon. And I think, personally, I think we've come a long way from not talking to each other to, and I will, since it's a matter of record, I will say that the council president, the county council president, has made a statement saying, listen, we have to get this issue resolved, and let's move forward and go forward together. And I think that this, if we're ever going to have an agreement, this is going to be the time. So I think that we should talk about the situation as to where we are now. The mayor's going to obviously come up with recommendations as well. And then my hope is that we can, between whoever it is that's sitting in the table, across the table from the mediator, we'll be able to come up with an agreement that's right for everyone. You have any questions? Okay. Thank you very much, Dr. Cohen. I appreciate it.
Thank you very much, and I'm available for anybody to call me at any time and pick my brain, whatever's left of it.
Thank you. Okay, the next item on the agenda is OPEB. Mr. Cordery, how are you?
Doing great. I'm gonna,
Is Jeannie, Jeannie, this is Lloyd, how are you?
hey, how are you? I'm just gonna load up the presentation.
Go right ahead.
He's coming right back. He just had something in his car he wanted to bring. Get in position.
This is the time we used to say smoke them if you got them, but. This is, yes, I have, yes. And yes, it's coming off
How come you didn't do
at the end of November.
a November one?
On November what?
November.
It would take me November
shave
in 2019 to have wood jackets.
I don't know how to take that. Yours certainly wouldn't be this color, I'll tell you that.
Oh, no, yeah, it would.
Wouldn't it?
Yeah, it would.
Have some reds in it.
My granddaughter thinks that I'm going to look like Santa in
Oh, my.
I'm not sure how good that
That's
is.
more pressure on you.
Want a cookie? I can.
No, I don't want a cookie and a glass of milk, no.
Jim, do you want a cookie?
I don't know, I'm looking at Julia's.
I got chocolate chip and oatmeal.
Okay.
Soon.
Which way is it? Can I click it, this, the hour, should we invite presentations, hours to cover the presentation?
I thought you were gonna bring 10 copies or
Yeah.
something?
Yeah.
I'll pass them out for you.
Mr. Council President, could we, for the sake of the people watching and here, go over what OPEB stands for? I had
I'm
to,
sure
I
they're
had to
gonna
call
tell
in.
us. Yes,
Call in, thank you.
thank you.
I was like, is that a derivative of OPEC? What are we doing?
You know what?
If only, right?
So we have Kevin Binder from Bolton Partners. He's gonna make a recommendation, presentation on the OPEB plan.
Great. Welcome, Kevin.
Thank you. Thank you for thank you for taking your time out to talk about this issue, which seems to be fairly obscure, which might be a good thing. OPEB stands for Other Post-Employment Benefits. So the post-employment benefit people are most familiar with are pensions. These are everything but pensions. And they come more into focus since around 2008, because before that time, they were accounted for almost on a cash basis and sort of buried somewhere in the financial statements. But now there's more financial accounting, they keep on increasing that. But the truth is there is a real cash cost, and it is increasing as that. So that's what I'm going to try and focus on. I'm not going to make any recommendations, but I am going to give 4 different alternative scenarios, and one including the current. Just let it ride what you've got there now, and give some of the pros and cons, give some idea what the financial impact would be, and so you all can make an informed decision. That's my goal. Okay. Now, I'm going to try this here. Okay. So this is the current situation on the ground as I understand it. The way it works is if I work for the city of Salisbury for, say, 30 years and I retire with a pension, or whatever the retirement eligibility is, it doesn't really make any difference how many years I'm working for the city, as long as I'm retirement eligible. The city pays 50% of the medical premiums for life. So probably for a public safety person, that could be many, many years. Or any employee who retires on the early side. It also includes the cost of a spouse, or the entire family, for that matter, until you're age 65, or if you have adult children. To give an idea how much that costs, I'm giving you a couple numbers here. These are the current premiums for the medical plan. They're average around $500 a month for retirees before age 65. However, that's not the real cost, because people my age, who are close to 65, are more expensive than your typical employee. So the real cost for your retirees is probably more like about $750 a month until they're age 65. At that point, Medicare kicks in, and that cost for Medicare of $519 a month is more the cost. So half of that would be for the over age 65 participants, over $250 a month. But that's for one person. It would be double that if a person had a spouse. And it would be more like $500 a month per participant under age 65, because if you think of the total cost being $750, the retiree pays half of that. That's around $250, so that works out to, just in rough terms, $500 a month. But that would be double that amount, or even more if you had an entire family. Currently, the current cash cost, the data I have, is around $500,000 per year for 74 retirees.
Is that the half that we pay, or is that?
That's the half that you pay. It doesn't include what the retirees pay, but it also includes an estimate for the sort of the subsidy, that the good deal you're getting for, like, if I could buy for a retiree who's age 62, he's more expensive than that in premium. So it includes half of the premium plus that additional cost for the fact that retirees under age 60, people who are 55 to 65 are more expensive than your typical employee.
Okay, so if we have 74 employees, 74 retirees,
Uh-huh.
is that over all of the employees that we've ever had in the city of Salisbury? That's how many people have
They currently are taking coverage, yeah.
either retired or maybe they retired and they passed away, so they're not in that number anymore over the last,
This is what we have currently that we're paying annually for.
so the cost is $1 million?
So, well, the total cost is a little less than that. You mean the total cost if you include what the retirees pay? Is that what you're asking? It's a little less than that because the retirees under age 65, you're paying really more like 2/3 the cost. So
Okay.
it's because that.
So
that's
is that
subsidy.
$500,000 the cost of their health insurance and their retirement, or just their health insurance?
Just health insurance.
Insurance.
Okay, now, not a math teacher, so just if you all
I'll
will
help.
be patient with me. We pay half of the premium, correct?
Yes.
Well, if you have 74 people and half of the million is 500,000, I don't see how those other numbers. 74 employees,
Right.
It can include a spouse as well, so that's not the number of participants. It could be
Okay.
more people.
so that number is higher than 74.
If you, as a retiree, it's not, there's two ways to count retiree medical. One is people, including, let's say you have a retiree with a spouse and 3 children, that would be 5 participants. I'm counting, we'll call contracts,
So
retirees.
there's 74 contracts.
Correct.
Right.
Okay, so those 74 cost us $6,756
An average.
each contract.
An average.
Yeah, but averages, you gotta be careful with
True.
the averages.
I
because-
didn't think that those numbers were reflective of what the real, I couldn't do the math and come up with, figure out how 74 retirees cost us. But if it's me and my spouse and 2 kids,
2 kids, it's 4.
so how many people do we have that are retired that still have a spouse and kids on their insurance?
I don't really have the exact counts, but what I do have is, I can give you later a report where I have sort of a summary of the coverages on page 11 of our report I can give you. Do you have
Okay.
the actual report, not in the PowerPoint, the actual report itself?
It's not in the PowerPoint.
It's not in the
It's not
PowerPoint.
in the PowerPoint.
I have the detail with me for exactly these kind
But
of
these
questions.
74 people represent all of the people who are we now.
74 contracts.
74 contracts represent
Yes.
all of the people that have ever worked for us that are still retired and alive and we're still paying for.
Yes.
And their kids, if they're.
And their
involved.
kids or
Yes.
whoever, okay.
And I'm gonna mention one caveat in a minute. There is an assumption. Our people that look at that bill and say, I'm not gonna pay it, I just assume get my own insurance. And there are people who waive coverage, and we assume about half do so. So there may well have been 150 people in this situation in the past, some of which just said, it's very expensive. They got another job or whatever when they retired, and they said, no, thank you.
Mr. Council President, didn't we have a discussion, I don't know, a year ago about this and we dropped it?
No, we had talked, I had raised the issue during a budget session and said that, and my concern at that time was the fact that we had a unfunded, undefined liability,
Right.
and that at some point in time, we're gonna have to address it. Hence, we went to this.
Well, I don't want to ask a question, we'll make no question before it's time, as the thing
Right.
is. But the page 5 has this estimated projected cash cost in it. And is that because through human resources, we expect to have that number of contracts go up from 74 in 2021, 26, 31, and
Yeah, well,
2036?
I prefer to do it in order.
Yeah, let's.
Let's do that then.
yeah, I
You shall
was
not
gonna
ask a
suggest-
question till page 5.
Yes.
But especially since it's really not fair, I do this all day and you don't.
Go right ahead.
So, and I want to make several Well, let me start here with the next slide here. Well, let's see if I can get that straight. So I accomplished something today. Okay. I'm going to talk a little about actual estimates. And one of the things you asked the preceding gentleman was how confident you are in your projections.
Right.
And my answer is not very confident. However, because I'm dealing with things that happen 50, 60 years in the future, if I really knew that, I wouldn't be here. However, what I think I have a good reason for my methods and my assumptions. And what you really want to think about is, I'll try and point a few things out, but you really want to think about when you're comparing the three or four of the relative weights. So even if this estimate I'm going to have that you're looking at is a little bit off, but you want to look at vis-a-vis the other three scenarios as well. And so I'll try and point that out. But I do want to point that out because it's, we don't know how fast medical costs are going to increase in the future. So that's a key estimate. We don't know how fast medical costs will increase in the future. They'll always increase. We don't know how much they'll increase, 2%, 15 or 20%, and it can bounce around. Okay, so anyway, one of the things the Council President mentioned is addressing the OPEB liability in terms of a trust. The fact on the ground right now is the city does not have a trust. And what is happening right now is you're paying it this goes. So I'm going to focus on the cash flows. And ultimately, that is where all the numbers come from anyway. Ultimately, it's follow the cash flows. The problem is going to be, I'll go to the next estimate, that one of the alternatives, you don't really see the cash flow change for many years. But I'll deal with it in a minute. So I'm going to talk a little bit about the assumptions I'm going and why I think they're the best available assumptions. We use the state assumptions for turnover and retirement. We assume the city is representative of the state. There's nothing different about the city vis-a-vis, Prince George's County or all the other entities in the state of Maryland. Frankly, it would be, expensive use of the city resources to hire me to study your experience, unless you had some reason to think it was very, very different and the numbers could, but that's why we use the state assumptions. One of the key assumptions that people are all interested in is mortality. And mortality estimates have been updated recently. We used the most recent Society of Actuaries estimates for mortality, which is based on the population as a whole of people who are employed. People who are employed live longer than the general population, so the life expectancy is longer than, say, Social Security, you would say it is. It also has a provision for mortality improvement, so it's a conservative assumption. In other words, what we've seen in the last 30 or 40 or 50 years is people keep living longer and longer, and so we're required under the actual standards of practice to assume that's going to continue in the future. Just like it's been improving a couple of % a year in the last 30 years, it will continue like that in the next 30 years as well. So that adds some conservatism to the assumption. We also, the Society of Actuaries also has a medical trend model with a baseline assumptions that was selected by an economist, medical economist. So we use those assumptions, and I'm going to talk a little bit about that in a minute because it's really, it's a transparent assumption. It has economic assumptions built into it, so that makes it easier to understand, I think. This is the key assumption that's unique to the city, and the city administration basically told me is what's happening on the ground. Which is that we assume that if you have 100 people who are eligible to retire, 50 of them will take the coverage, and 50 of them will not take the coverage. And that's because, even though it's a very nice subsidy, it's still expensive, and some people may not be able to afford it. And some people may feel that they can, especially if they're a little older, they may feel that they can get a Medicare, an AARP type policy, or whatever it is that's adequate for their needs. Whatever, I don't know what's going on, but there are people who will not take it, and that's, you'll not see 100% of people take coverage. Even if you have a 90% subsidy, certainly if you have a 50% subsidy, there are a lot of people who will not take it. But that's something we probably should study a little closer to make sure that's on track. All right, now, I did tip my hand. There's going to be another measure we're going to use to look at called the actual accrued liability. And basically, this would be if you wanted to set up a trust or whatever it is, and you want to know how much money you'd have to put in this this bank account to pay all these benefits when due. It's sort of like if you're thinking retirement planning as an analogy. You turn 65, you retire, how much money should I have in the bank when I retire? So if you want to do that for all your employees, that's what this actual accrued liability, I'm sorry. I ran ahead. I'm sorry. apologize. So for anybody on the screen, I'm on slide page 4. This is an alternative measure of looking at things called the actual accrued liability. So what's involved in here is, again, we start with the cash flows. What we do with the cash flows is we discount them by an interest rate factor. So the idea is if you want $1 million in 10 years, how much do you need? You have to talk to a financial planner, and he would tell you, well, if you invest in this kind of investment, you can assume it's going to earn 5%. Or if you invest in this, you can assume 7%. So you discount that $1 million back by 5% or 7%, whatever your financial planner is telling you, and hopefully he's warning you this may or not happen, but whatever, at least you have a plan. And that's the amount of money you have. So it's less than $1 million. It's some other number. And then for employees, you don't necessarily need all that money on hand when you're still working. If you're halfway through your career, you would want to have, say, half and put a little bit more in each year. Now, this number is very sensitive because this is many, many years. We're talking about things that are paid out 50, 60 years from now for an employee to the interest rate you use. The numbers I'm going to show you are based on a 3.5% discount rate. That's basically the accounting interest rate you'd use, because it's basically something similar to what you would pay if you put out a bond. Local government bonds are roughly 3.5% right now. So that's what we're using to sort of give you an idea of what the total liabilities would be. And these are going to be the focus, when you get there in 2018, that's what you're going to be looking at in your accounting statements. This number is pretty much what's going to be in your financial statements in 2018 on. Okay, now, if I go too fast, I should be interrupted, because people warn me I speak fast. All right, and I also forget to turn the slides. All right.
We'll forgive you.
All right. Yeah, my wife could tell you other things. Okay, so this is your slide. I'm up to it now. So here, these are the estimated projected cash costs for the plan. Now, this is going to increase for a couple reasons. First of all, what's happening are people are retiring, and people are living longer. So you're going to have more retirees. But you're also going to have, your costs are going to increase, your per capita costs are going to increase, because medical costs have historically always gone up faster than inflation. I would say without an exception in my career, even though it's moderated in recent years, it might be going up 5% the last few years. Inflation's been about 1.5%. So it's still going up about 3% faster than inflation. And so when you look at these numbers, that's why I have two columns here. I have the dollars, the nominal dollars, as you call it, I think it's the term, in 2021, 26, 31, and 36, increasing from 642 to 2,002,000. That's an estimate. But the key, I think the more important number is to realize it's going to depend on inflation. And if inflation's higher, then both numbers will go up. That's why I have the inflation assumption we're using is 2.3%. That's similar to what the government's using, the CPO uses, CMS uses. That's, the federal agencies are assuming a long-term inflation of around 2.3% right now, 2.2, 2.3, and that's what the actual long-term trend model has as an assumption. So basically, that's the cost in current dollars. It's going to increase from $573 to $1,270,000. So basically, we're talking about an increase from $500,000 now to 2036 to $1.3 million, about $800,000 of real dollars that I'm estimating are going to come out of your budget. Not just an estimate, it's based on how much faster, really. It's not how fast it's going to increase, it's how much faster it's going to increase vis-a-vis inflation, which is probably around 3% a year. Okay, here we go. So this is the key component, this medical trend assumption. Medical costs increase faster than the rest of the economy. Basically, we're expecting them to increase a little over 5% through 2050, which is about 3% faster than inflation. If you take 3% for 20 years, that's a 109% increase. So that's your per capita cost increase in 20 years from now. Now, one of the ways you can control this kind of cost, or at least decide how much you want to absorb as a government, is to change the way you administer the benefits from a fixed percent
Right.
to a fixed dollar. And say, we're gonna give this dollar level, and we'll index it with some
can do
index.
it, right.
You can do 3% or whatever you want to index it, and that at least you have some
limits your
control over it.
liability.
It limits your liability. So it has two benefits. One is that it decreases our estimate, but it also means our estimates are more certain. Not 100% certain, but they are more certain. I will tell you that. I would be more certain on my estimates if you have a fixed dollar. Because for one thing, it's controllable. You can decide yourself how to adjust it depending on how you design it. You yourselves can decide, this year we're going to give this much of an increase. So it's more controlled. You have more control over it. Right now, it's like, well, you had a big accident or whatever, something going on, and it's my company's costs went up 20% last year. So it goes up 20% a year because we're a smaller group and whatever. But if it goes up 20% a year, you say, well, we're sorry, we're capping it at 4% or 5%, and the rest is absorbed by the retirees. It's harder than retirees, but at least it's something which is more sustainable. Okay. So these are two of the alternatives I'm going to present are fixed dollar alternatives that the city administration asked me to look at. I just wanted to, before I present them, I wanted to let you know there are people that are doing this right now. It's not, you would not be the first. I don't know which one's the first. Baltimore County put in a fixed dollar benefit for employees hired after 2007. So that's already a while. The Housing Authority of Baltimore basically put this kind of a plan in for everybody hired before 2006. And actually, the Housing Authority doesn't pay benefits after age 65 either. So it's really been very aggressive. There are a few counties that have fixed dollar subsidies. Cecil County always had a fixed dollar subsidy, and the city of Cambridge also had a fixed dollar subsidy. And this is it's sort of interesting, from my perspective, Maryland's sort of the Mason-Dixon line, I guess. It's sort of north of here, if you go to New York State and Massachusetts, people tend to have percentage of premiums and not pre-fund it. Matter of fact, New York State, you can't pre-fund it, believe it or not. Whereas if you go to, say, south of here, you go to Georgia, North Carolina, South Carolina, they don't give the benefits, they get fixed dollar subsidies. They tend to, not always, but that's the tendency. So Maryland's sort of in between.
Do you have any information on the percentage of governments that have a benefit like this? Because the trend in private sector is to do away with the benefits.
Yeah, and that's sort of what I was saying. It's if you go north of here, most governments provide these benefits. If you go south of Virginia, or even most of Virginia, you don't find them as often. And if you find them, they tend to be fixed dollars. Another example is Prince William County, which is a fairly large county. They're a fixed dollar subsidy. So you tend to have a little bit of a little bit of both. But in terms of this percentage of benefit formula, outside of the Northeast and California, I'm not sure what it's like in Oregon and Washington, that part of the world. Outside of the coasts, this Northeast and this whatever, in that part of the world, you don't find that many of these benefits. Okay, which is still a large chunk of the population. Whatever, you get into the election politics here. Okay. So now I'm going to present the options we looked at here. The first two options are fixed dollar subsidy benefits. And these are actually totally fixed. So as opposed to what you can do is in between is what's called a soft cap as opposed to a hard cap. These are hard caps, where basically the number is fixed at the current dollar level, and that's it. It doesn't increase at all. Okay. So under option 1 and option 2, there are 3 tiers of participants. People who are already retired are what we call grandfathered into the current plan. There's no change to retirees, and that's typical. Most people do not, outside of bankruptcy type settings, do not to change benefits for people who are already retired. Even governments I've worked with have made pretty radical changes, haven't touched retiree benefits. Okay. The second tier is going to be current employees. That's your major tier. That's going to be the driver of most of the numbers. And the third tier is future hires, which gets really into science fiction because they don't exist yet. but we can make certain estimates about that. But you won't see the cash flow impact for many years because, which is why I have the alternative measure, because they're not going to be retired for 20 years. So you won't see a difference in cash flow till 2036, and then it'll be very small for a while. So those are the three tiers. So again, for option one and option two, there's no change for current retirees. Under option one, the current employees would get a $3,500 fixed dollar subsidy, and that would be it. And there would be no
Is
spouse
that
subsidy.
every year, do they get to carry that over to the next year?
Well, it's less of the premium, so it would be a moot issue. They'd have to apply to the premium, right? So in other words, right now, the premium is $500 a month, say. So that works to $6,000 a year. We'd say, okay, whatever the premium is, we'll pay $3,500, you have to pay the rest. Okay, let me try again.
No,
You got it?
yeah.
Okay. Is that okay for everybody? Because this really is, this is an important point, so it's not, I don't want to go too fast.
Oh, go ahead.
Okay. Basically, for future hires, they would get the same benefit as employees, except for that every 20-year requirement to get the benefit. Okay, that's option one. Option two is very similar, but it's a little more generous. Okay. The major difference between option one and option two is what happens to current employees. Option two provides a subsidy for family coverage. So $3,500 would be the subsidy level for an employee. A person who had a spouse would have a $7,000 subsidy, and a person who had a family would have a $9,500 subsidy. So it provides more family coverage. The future hires have the
Do
same
you
benefit.
have any information about what the average cost for the family is for the city?
Typically, family coverage is about 3 times the cost of just employee coverage. Depends how many children you have and what their ages are and
So
whatnot.
it's $30,000 for a family?
Well, the current cost would be it's a little less than that. I think right now you're talking 600.
I'm doing family.
You're talking about a family.
I'm sorry, it says $9,500 up there under fixed cap on family employer subsidy.
Right. Let me back up. When you're asking your question, if you're dealing with a 35-year-old employee or you're dealing with a 62-year-old retiree? It depends.
Well, I'm under current employee benefit, a $9,500 fixed cap on the family employer subsidy.
Yeah, this is basically what the benefit under the proposed alternative option two would be for people who are current employees. So basically what it's saying is, if I'm working for this city right now and I'm 45 years old, I'm going to retire in 15 years. So basically when I retired, you'd say, okay, you want to cover your family also? We'll pay $9,500 towards the premium, you'll pay the rest. Now, how much would that premium be? It would probably be in the range, it's going to increase the medical cost, but let's say under current dollars, it would be probably in the range of about 600 times about 2.5, something like about $1,500 a month. So about $18,000 a year.
But this would be assuming someone's 60 years old with a couple kids.
The kids would be more expensive, that's right. That's right. The kids wouldn't be more expensive. I'm just
Do you
going
have
to,
anybody who's retired that still has their children on their health insurance?
We have some that were injured on the job, went out under disability, accidental disability. So they have their children.
I mean, is that 25 of them, 30 of that 75, how many is
Probably
that?
about 3 that have their children.
Okay.
And I think two thoughts on that is, one, today we pay 50%. So if it's 3 times the average $6,000, that's $18,000. So if we pay 50%, we pay about $9,000, and they pay the remainder today. The other thought I have is that the aspect of setting that rate, whatever it is, for me, that's important is that we have a policy, even if it's a small number of people, that take advantage of it, and that we offer the option.
And I believe the intent would be that if we went to something like this, the actual benefit would be 50%, but not more than those caps. So obviously, if 3,500 was more than
50.
50%, it would be limited to 50%.
What's a cap?
It's a cap.
And it doesn't roll over to the next year,
Okay,
the difference.
okay.
There's nothing coming.
They do. It's just that right now, in order to be eligible to take advantage of the retiree medical, you have to have 10 years of service and be ready to retire. So this is saying we're going to change that for our future hires. When they come in, they have to work a full 20 years in order to take advantage of that benefit, as opposed to working 10.
What's the percentage of employees that reach that 20-year mark?
Yeah, I think that's where I am. Like
Yeah.
Mr. Boda said, I'm trying to figure out whether or not the sky is falling or this is 3 people.
Well, the sky is falling, because, the sky is falling, because we owe $29 million right now. We owe $29 million, and we just paid $500,000 toward it, and so it's 28.5. And we owe a ton of money, and we've got to do something about that. So, the public sector organizations and private sector organizations that didn't, you know their names, Enron, you know, they're famous. WorldCom, they're famous.
State of California.
And so, state of California. So most places have done something about this, we haven't. So we have to,
Well, we did a tiny thing,
a tiny bit.
right. Back in 2007, I believe it was 2007, when the Gatsby 45 legislated that we're going to, 5 years from that point, need to show your unfunded liabilities on your taxes, your balance sheet, whatever. And it just continues to roll and roll and roll. And because we haven't paid that debt down, we don't get a very good interest rate compared to what we would if we put a lot more money in. We would have a better chance of getting a better interest rate, which then softens the blow at the end.
And having just sat with Standard & Poor's and Moody's in New York, this is the issue at the table. I mean, everything else, you know, we are just lauded for our financial picture. And, you know, this is a relatively easy fix, but it's one we have to fix.
But it's a fix on the back of the employees. That's the
No,
fix.
it's really a fix on the back of the future hires.
Future hires.
Future hires.
Then it's a fix on the back of the employees.
That's right. It's changing.
And I just
it's
can't
changing
figure
the
out
negotiation with future,
You know,
these people that don't exist.
I recognize that the 29 million, you know, that's here, or 27, whatever is here in 16. Is that the same thing you're talking about, Jake?
Yeah.
Well,
Again, I will say my complaint is with Gatsby, and numbers that you don't have, employees that you don't know how old they are, you don't know how healthy they are.
well, I don't know how old they are, but I know how old they are. I have a census.
Understand that.
I do
But
have an
20
employee
years
census.
from
I
now.
have an employee census, I have, you know,
Because we went through this the last time. We said $1.2 million, and then $29 million comes up, or what is it, 27 on
There-
page?
there-
I don't mean to skip to page 11.
either,
That's why we brought Kevin.
let me finish the presentation. I'm not here to make a recommendation at all. So it's not like you don't have you both have valid points. So I want to just go through so you understand the issues here, so you can make an informed decision. And let me finish the third option, though, all 4 options here. And these are independent of the issue of free funding. It's a separate issue, you know, that exists. So let me go to option 3. This is the last option, which we haven't discussed yet. And this is basically just to close the plan for future hires. So this is really on the back of future employees. Options 1 and 2, just to clarify, really are on the back of the employees, because you're saying is, right now I'm working for you, I've worked 15 years, and we're changing the terms. Before, you're going to retire in 10 years, we're going to pay half the premium. Now we're only going to pay, if it's just you by yourself, $3,500 and then no more ever. So it is a fix which is on which is being paid for by the employees.
Unless we chose to increase it.
Yeah, you could choose to include it, but basically, right now, you have an agreement saying you're gonna pay 50%, and the reason the numbers you're gonna see are lower is because we're saying we're limited that to $3,500. I would counter, from the employee's perspective, you don't wanna overpromise something you cannot deliver, and right now, you haven't pre-funded this. So, I have local governments that, I've talked to, and I said, I'm all for these benefits, but if you're not, try and pre-fund them. Because I've talked to certain governments that actually have some funds in there, it's a political decision what to use their funds on. But you want to make sure for your employees, is make sure they understand that even right now, this depends upon the city's ability to make these payments. Right now, you don't know what the city's financial position is going to be in 15 or 20 years. If you have a retirement trust and it does well, it's invested properly, whatever it is, which is another hassle for somebody to do, then at least you have that cash built up to pay for it. All right, those are the four options. So the current plan is you could do nothing. That is an option. And options 1 and 2, which are different variations of putting a fixed dollar subsidy. And the fourth option is just to say, if you come in, you're a new employee, you're hired here, we're not going to provide this benefit anymore. But if you're already here, you're in the current system. You'll create basically 2 tiers of employees. Okay, so let me give you the numbers here, and then we can talk about, and you're right, I mean, these numbers are soft numbers. I mean, because they're our best estimates, they're not done willy-nilly. They're professional numbers. However, if I knew the future, I wouldn't be here, as I said. I mean, I might if I really wanted to, but the point is, I could make money doing something else. Okay, so I'm gonna this slide here. So because the difference in the current plan and option 3, which is basically closing the plan to new hires, there's really no cash flow impact for 20 years. The cash flow impact will be 30, 40, 50 years from now. So therefore, I'm showing these numbers, basically the accrued liability, which is basically the number on your balance sheet. Well, it's not yet, but it will be the number on your balance sheet in 2018. Under the current plan, the liability is currently at almost $28 million. If you go to option 1, those numbers drop or decrease to $18.2 million. In option 2, $19.4 million. In option 3, it's the same number because there's no change until you hire new people. Just skipping ahead to 2031, the liability is projected to increase to $67 million. This is in 2031 dollars. I haven't given real numbers because it is what it is. In option 1 would be $29 million, and option 2, $32 million. So you can see that you've basically more than halved your liability by going to either option 1 or 2. Option 3 also reduces your liability substantially by about $12 million. That's basically the value of accruals for people hired for 2016, 2031. So
And this is based on the 74 contracts we have right now.
No, it's based on all this number here for option 1, for example, the current plan, is, I have an estimate here. It includes your 74 people. It also includes all your employees here. I think there's approximately 300 employees. All of them have a possibility of staying on and retiring and taking the benefit. So
you're basing these numbers on the 74 that we have and the assumption that every person who works here right now is going to retire from here.
Well, that's what we're required to put.
That's what I'm asking. That's what I'm asking.
Required to put as the liability.
There's a sliver. In other words, let me put it this way. For a person who's a 25-year-old hire, I have an assumption, based on the state assumptions, there's a significant chance that employee will never reach retirement age. A large chunk of your people who are, say, 25, maybe say 3/4 of them will not reach retirement age. They will leave in the next within 5-6 years. That's built into the numbers. There's also a 50% chance that when the person retires, he will not take the benefit. So the number we have for 25-year-olds is very small. But if you, on the other hand, if you have a 58-year-old who's 30 years of service, the number's pretty high because he's already retirement eligible. And all he has to do is say, I'm out the door and I want the same coverage. So that liability for that person is very high. So that's what's built in. Also, under these assumptions, I have a provision, I'm assuming your population stays the same, and that as I project people to leave, they're being replaced by new people. That's built into the first column. Option 3, it's not built in. Option 3, I built in basically only the current group and nothing for future hires. That's the difference between the current plan and option 3. There's no cash flow impact for 20 years under current plan option 3. All right, now this is another look at it, the whole thing. This is the cash flow. Now, one thing I want to point out on this slide that is easy to miss, this is not the whole cash flow. This is the cash flow for excludes the 74 people. This does not have the 74
So
people.
we should add $500,000
Well-
to each one of these?
What's gonna happen for the current 74 people, every year, some of them are gonna die, and some of them, and the cost is gonna go up. So depending on how old they are, let's say, just rough terms, the cost goes to 5% and 2% pass away, or waive coverage or whatever, so then the numbers will go up 3% a year for those people. But eventually, the mortality rates go faster than that. Eventually, when you're 70, it might be that number, it accelerates. So at some point in time, all these people are going to disappear because they're retired already. It's sort of morbid.
I'm sorry, you just said once people pass away, the cost goes up?
What I mean to say is, as people get older, mortality rates increase. So if I tell you, right now, your average retiree is age 67, there's a 2% chance they go.
Gotcha.
20 years from now, the average of this group will be 87, the mortality rate may be 7 or 8%, and so then they'll start coming down. So I actually have a few plans I do that are closed groups of retirees. The average age is 87, 88, and the cash flow is just dipping pretty precipitously. I have a few like that. Okay. So the key thing is to make this comparison to the plan changes. I've stripped out the 74 retirees because they're the same. So you can see the changes more vividly by focusing on just the future, what we call future retirees. It excludes the 74 retirees. So by 2021, in 5 years, I'm saying if you're 50, your people who are in their 50s who are eligible to retire, there'll be, I don't know, I guess 15 or 20 or so will be retired in 2021, paying $280,000 into the current plan. Same thing, skipping into option 3, because there's no change. However, under option 1 and option 2, the cost is less because you're fixing the subsidy at a lower level. So you can start seeing the cash relief, so to speak, to the city, which isn't really a lot of money in 2021. But by 2036, it starts getting more substantial. Then the story is, if jumping in 15 years, this 20 years from now, I don't think I'll be here presenting, at least. Hope to be around. The number is $1.4 million to the current plan. In option 1, it's $640,000. So you start seeing some real savings, and that'll continue into the future. And what's nice about this, from the perspective of employees as opposed to option 3, is they'll still get something. I think that's
Might
all I
I
have.
ask?
Sure, absolutely. That's what
Even
I'm
if
here
the
for.
city went ahead and took $800,000 right now and put it into that to reach the $1,389,000, because we're doing $500,000 now. I know I have a tendency to take a ledger like I do at my house, and either the money's here or it's here. No, it doesn't work like that in the head of our financial gurus. It doesn't work like that, I know that. But even if we put $1,389,000 using the current plan in the bank and said this was for that, you'd still come back here and say, because of Gatsby, the sky is falling. So my question is even if we are paid up to what you suggest is the cost in 2036 by your best estimates, it still doesn't satisfy this sheet. And I think we all know we're not putting $66 million in the bank for this. So what is it that they suggest? We had this conversation the last time we did this.
Well, let me back up here. I will tell you this. There are organizations that have been putting the money in the trust since 2008, and some of them also made some plan changes, and I have a couple that are close to 100% funded. And so from the gas perspective, it looks
On which
better.
page? On the actuarial page at 66 million, or on the cash flow page at 1.3 million?
They have a trust that's just like a retirement plan. Like the state of Maryland has a retirement plan. So when the state of Maryland has this retirement plan, they look at, say, what are $20 billion of liabilities and $15 billion of assets, and the S&Ps and Moody's will say, well, you're $5 billion in the hole. It's very nice you have $15 billion, but you're $5 billion in the hole. So I have some local governments that have, say, $70 million in assets and in liabilities and $65 million in liabilities. So GASB says, okay, you're $5 million short. It's, it's.
So
not-
they're still mad about it,
and they're-
even after they did all that?
Well, they're not mad at, they reflected in their, they have other debts and, they have other debts. I
So
mean,
what, let me ask you a
if you have a
question.
large
The mayor's
organization-
going up to Standard and Poor's. What do you want?
I don't know what's.
Because my question
I can't
before I
speak
make
for
a
Standard and Poor's.
decision about employees and their
Right.
futures, and I start to gauge benefits packages versus how long people stay versus the quality of the work versus the commitment to the job.
Well, so.
I mean, I'm trying to figure out what I need
It's
to
a
give
values
you.
discussion, right? It's a values discussion. It's not just a dollars and cents
Yeah,
discussion. It's a values discussion. And I think the way I look at it is, we want to make a couple promises to our employees, right? And to somebody coming in. And I think the most important one to make is one that, you all passed a couple weeks ago, which is that when you come to work here, much like the military, you can expect a 2% increase in your pay every single year. That's a promise we make. It's in our, now it's in our personnel handbook. And that is just part of you can expect that. That is a part of the cost of doing business. And we will consider cost of living adjustments. So you can expect to make forward progress from the day you arrive to the day you leave, even if you don't get promoted from one grade to another. I want to come in as a police officer one and stay in that job forever. Now there's the PFC, formulaic jump, but I want to stay in that job. I don't want to get promoted to sergeant or lieutenant. I don't want to do anything else. I want to do that, and that's the only thing I want to do. You can expect to still see a 60% increase in your pay over 30 years, and that's reasonable because there are things that change, like inflation, cost of living, and people being stuck at the same salary get really angry about their experience at work, when they don't feel like they're making forward progress. So I think we've made a big step by making that promise to them as an organization. The next piece is to think about when they come to work here, they're coming to work for the government. They know they're not going to get rich, but I think we just made them a big, we just showed that we value the employees through that step. Now, they know they're not going to get rich, but what do a lot of people expect when they come to work for the government?
Benefit.
Decent benefits. So we provide that in a lot of different ways, right? One, we provide that in terms of work hours and leave policies. We have incredibly generous leave policies. One of them was improved again recently, the military leave policy, but we have generous annual time and sick time. And another one is this, right here. And it's the contribution to healthcare. One, while they're employees, and we're not really talking about that, but in retirement, we pay a portion of that. And what a lot of places have figured out is that was a generous benefit and it was completely unaffordable. And nobody did the math because the math seemed unreal. Those numbers are just huge and let's ignore those because they're far off. And this was a long time ago and a lot of places did the same thing. What I think we're discussing here, and although you're not here to make a recommendation, I am,
That's your job.
right, and so I'm recommending that we go with option 2, and that's what staff recommends. And the reason being is that although we're talking about a change for current employees, not current retirees, no change to current retirees, because I believe, they're already in the system, they are retired, I don't want to change anything for them. But there is a change for current employees because, and I feel comfortable making that change because it is approximately what we would expect those costs to be in the coming years. So people who are near retirement, people who have reached that 10-year mark, they can expect, okay, I'm going to probably get about 50%. It's $3,500. They're not telling me 50% anymore, but they're pretty much upholding the bargain that they told me they would. And $7,500 for a couple and $9,500 for a family. It's pretty much what they told me when I came in. And that's why I think it's a reasonable, and if we think that number is wrong, let's talk about what that number should be. But the simple change from going from 50%, which it affixes itself to this ever-rising, ever-inflating cost, versus changing it to an actual number, even if it's the same number, even if it's about the exact same thing, reduces that liability.
Agreed. But in option 2, on the ugly page 11, page 12 looks good, page 11 is awful. We're still $31 million. When you go to standards and Poor's, when you go up there.
In 2031.
Well, you'll be here and I'll be here.
Well,
Under a couple employees here, I guess.
under
I guess
option-
what I'm
under
worried about
option-
is this.
under
I'm
option
worried-
2 is $19.4 million.
I'm not late for
Well, in
that. I'm glad to be with
2031.
you.
Oh,
is where I went down.
31.32, yes.
What I'm worried about is that when Jake's gone and I'm gone and everybody else is gone, that we're gonna sit here with Mr. Cordry, because he'll still be here, and he'll be saying, well, this actuarial thing still got us, and there's gonna be a mayor who's going, Mr. Cordry, because Mr. Cordry will still be here. He will say, well, we gotta do something about it, and then the benefit drops again, and the benefit drops again. Could I ask about the option of putting the money away,
It's a
like
separate-
the other people have done?
It's a separate discussion. I mean,
But I think that's part of
it's
it.
a benefit. I didn't prepare the numbers, but you could set aside money into a trust.
Because as a public employee, I feel like you're gonna come back here every 5 years, and before long, you're gonna tell me I'm hired. And though it says 2%
I
in
would-
the employee handbook, we have no idea whether or not we'll be able to do that given set of circumstances. And then you'll just say, there are no benefits. And that bothers me because we incentivize everything in the city. And I have been a proponent of doling out those credits downtown. $1.4 million, 900,000 of it in surplus just the other day for radios. And now we're back here and we're saying, well, a cut's got to be made, and guess where it comes from? It's going to come from you, the people who are out there doing the work. And I find that to be distasteful and not something that I want to do. I'm willing to look at options, but I just
Can I-
feel like in 10 years, we're going to come back
Can I-
and it's going to be the same thing again.
Can you tell me in 5 years what the medical cost is going, health cost is going to be in the United States?
Well, no, I was
No,
going to say,
that's a question.
well, I was going to say, if we use his, what was your increase, 5% a year over 20 years?
That's right, that's.
I mean, he's the expert, not me.
Under
That was
this,
his
yeah, under this,
question was for him.
under this option, you're basically, you're largely, not entirely, but mostly insulating yourself from that variable by just saying it's capped. Now, there's a separate issue if Standards & Poor's is whether you want to put money into a trust, which is a separate issue. I'm basically for it. The problem is going to be, it's easy for me to say I'm for it because I'm not paying for it. You're going to have to come up, somebody's going to have to come up with some cash to come up with it. And I haven't calculated that amount for you. But, it's expensive. I would say this, one of the things that the GFOA or whatever it is, the national organization, which is not me, is not for, is coming up with an OPEB bond. What I would not recommend you do is take a $32 million number and float a bond that the GFO is against. It's not even me. They're against it. Because right now you have what's called a soft liability. You just do. I mean, it's let's say, an extreme case, let's say they totally reformed healthcare. Somebody, it sounds like a pie in the sky, but they totally reformed healthcare. They came up with some magic bullet, which would probably involve some pain, but they just redid things. These liabilities could even, in theory, decrease. So you don't know. But so it's not. It doesn't make sense to come up with $32 million by borrowing it. But you'd have to come up with some other. I'm not in a position to say where you come up with. You have to come up with other cash to come up with to accumulate this kind of money into a trust. Once you do that, what Jeannie alluded to is we typically, and under the current GASB standard, accounting standard, we are allowed to use a higher discount rate to come up with these numbers. Now, what I would recommend you do not do is come up with an unrealistic discount rate of 7.5%, 7%, because you're wed to those, like the pension, like the state of Maryland pension plans, where they think they basically thought they could get 8 or 9% years ago, and they have a hard time bringing it down. If you do something like that, I'd recommend you get a financial person here. It comes with a real attainable rate. Based on what I'm seeing in my pension plans the last 10 years, and OPEB trusts, people are averaging in the last 10 years about 5.5% return. So you could come up with a lower liability by assuming you're going to have investment return to offset some of this cost. You could.
Oh, one more question for this nice man, it'll be my last.
Promise?
Promise. If we took $800,000 and added it to the $500,000 that we have now that we're spending, and we met the $1,389,000 that's projected for 2036 under the current plan, okay? I'm just saying, we spend $500,000 a year on it now.
No.
That's only the
We just did that
future
one time.
retirees.
We did it once.
What was
Do
it
every
this
year.
year?
Yeah.
Well, what do you spend?
I'd have to come up, I'd have to come up with, recommended contribution if you were to, we'd have to come, it would be a multi-stage. If you really were seriously wanted to pre-fund it, there's a lot of things to think about how you do it. First of all, how fast do you want it to pay for it? Do you want to try and make up the money in 10 years, 30 years, or 20 years? How are you going to invest the trust? What's a realistic investment return? What I did do
So
for,
there is an option for a lockbox.
yeah, you can
for
create a
this-
lockbox, but it
I just
depends
brought
on.
up a word for 2,000.
No, it's an
Should
irrevocable
probably
trust.
leave
You could
that.
create the city could create an irrevocable trust. I think there's also, it could be you could use other, I'm not sure if you go to the Mako Trust or not, or it's only for Maryland counties, but there are certain Maryland trusts.
We are looking into that.
You could maybe.
I mean, is it
use the Mako
creative
Trust.
enough that we
That
could
would-
take the
that
savings
would
that
work.
employees have from
What's
their
that?
health insurance and be able, there have to be creative ways to
Come up with
to
the
put it
cash?
there.
Well, I can't print money. It's cost money.
I mean, we're just getting ready to tell people that we've asked them to do all this wellness
No,
and
no, I
get
understand.
healthy and do all this stuff, and now we're gonna say to them, well,
That is my solution.
because of
is to
somebody
join
in
the gym.
Gatsby who wants you to have
Well, they just want. they
30,
just-
on option two, $31 million in the
I think we
bank.
need to go back though, because again, I think we're talking about what was a generous, but I think ill-advised position for the city to have a long time ago on the backs of taxpayers, and shouldn't have been set up that way. And I think we should retain a relatively generous relationship with current employees, and that's exactly what's being proposed. In fact, they'll experience no difference at all. So in the next few years, retirees won't experience a difference. That's what we're being told. They won't experience.
It just seems deplorable to me to say that we're gonna hire you for lower than you're gonna make in the private sector, expect you to be here when there's hurricanes, when there's crime, and then turn around. And I still, again, if someone could give me a paragraph about these Gatsby people and this actuarial accrued liability that I could say to somebody who's picking up the trash on my street, I'd appreciate it. Thank you so much for your time.
Sure. Find something.
Mr. Mayor?
You know, I just think a couple things have been discussed tonight, and a couple things have not yet been discussed that we should talk about, such as health savings accounts, and the ability for employees to put money aside into, and even matched monies into addressing healthcare while they're employees. I think HSA is something that needs to be discussed. I think the idea of investing in paying down that liability, so a lockbox or a trust, is something that we could start right away. We already have started. We've started putting that money aside, but I think we could continue that on an annual budgeting basis, and I think that's what you're getting at, Jim. I don't think you do either without first stemming the bleeding. And that's what's been recommended to me, and that's what I recommend as well.
Any other questions?
Well, I think I concur as, when we look at option 2, that setting a cap, I think it's for the future, I think it's the right thing to do. It's a lot of money that, we're talking about for the future. We're not, and there is a concern because we have to, the goal is when we're done working here is to make sure that we pass this on, for the next councils, the next mayors, and future taxpayers. So I think that's kind of, I agree with that sentiment, and even going through this before tonight, as I was looking at it this afternoon, I was leaning towards the option 2, because as with the future hires, what you're doing is you're gonna offer the employee themselves to purchase the health insurance, but it's not gonna, future employees, it's not gonna cover the family. So we're taking care of our current employees, but for the future, we've gotta make a change. And a lot of people who, in today, with 2-income families, or, like my household is 4 incomes. My wife has 2 jobs, I have 2 jobs. So, we, you know, my employer, I have an option in the future for my main job, my wife as well, actually for both of our jobs. So some people are in that, now some people are in that situation, some people are not. So, you know, it's, I think option two for me is the one that's gonna be the most financially responsible for the future.
I
Mr.
think,
President, what does this question is for Jeannie, not for Mr. Cohen. That was the last, I'm sorry.
go ahead,
That
no,
was
go
last.
ahead, go ahead.
That's fine.
Jeannie, what is the current employee benefit when they retire, the $3,500 fixed dollar cap? How does that system work? Do they have a card that has $3,500 on it, and when they use it up, they use it up?
No, basically, we would have to bill them for the difference. They,
You should save some money by
They
putting
go
it
to
on
the
a card.
doctor and just.
they'll have their Care First card. It's not like they're gonna go out and get another kind of health insurance.
Right.
We do the same today. We have it like a premium, so if your premium's 6,000, we bill you for 3,000. So you pay 3,000 of your 6,000 premium.
Regular people, I'm going to the doctor. Let's do regular.
You just
people.
have Care First, just like you
Just
do
like
now.
everybody else, yeah.
And when you go over the $3,500 mark, then we start to bill you?
We know this is what the cost is gonna be annually. We divide that up over 12 months. And we know we're gonna spread that 3,500 out over the 12 months.
Well, and I guess it would now, how, I guess maybe more what he's asking is how does the retiree pay? Does it come out of their pension?
No,
Or does it?
No,
it's-
no,
they
no,
gotta
we
write
don't
a
have
check
a-
to
Bring
the
a check
city?
in.
yeah, or they can drop a check from their checking account. I don't think we have electronic bill pay yet. I know we do have, you know, if you have a banking system like I have, I can just tell it, I want
Pay
to
the
drop a
bill.
check, and even though they don't accept it electronically, they actually will print a check, drop it in the mail.
Do you have a table that, if it's gonna go up by 5%, how far $9,500 is gonna go for a family in 2036?
Do I have a table?
I mean, if these are fixed numbers, do these numbers ever go up and get adjusted for inflation?
We could do that.
One key
Yes,
thing.
you would.
Because that's
we're-
kind of says
think
to
we
them,
want to
oh, we know all this is going up 5%, there's your fixed numbers, and 30 years from now, everything's up, everything else is going up 5% a year, but yours is still staying at 9,500. And my other question really is if we have fewer people on the family employer subsidy, would it be better to flip those numbers a little bit to make it easier for most of the people who are, I don't know, most of the people who retire, are they married?
Yes,
So they're gonna be in the fixed dollar, is that husband and wife?
yes.
Wow, it's 2016, Gene, we can't use husband and wife anymore.
I didn't do
7,000,
this.
come on now. I'm just saying, I'm just wondering if there's a way to incentivize people staying by and that's something you'd have to check out in 2036. and we're not
Well, let me
here.
ask two things. One, I'm sorry, Mr. President.
Yeah, I just, a couple things I just want to respond to, because I do have some experience with pension programs and the like, and benefit packages. The trend is not to, for instance, on pension, the defined pensions anymore are done. That's a thing, you can't afford them. So when you refer to the private sector and say, well, they get more money in the private sector, yes. They also have to put in their 401K and create their own pension. They also have to put in their medical for their spouses, because very few companies now are doing families. So this is not a trend, this is not something we're starting. This is happening and has been happening for the last 10 years, slowly but surely. There have been companies that have gone bankrupt and out of business because they were not able to fund their benefit package. You read about them all the time. So at the very least, we have to change it from a variable liability to a fixed liability, because then we know a number that we're dealing with. And that's important. I respect our employees, they're great people. I think they should get the benefits that they get, but I will tell you that we can't afford to keep up with what's going on in the healthcare industry. Certainly, we have to do something. And that's, that's how I see the thing. So the advantage of going to the private sector isn't as big. It's bigger, but it's not as big as what we have.
I guess one thing I would throw it out as, if you go to get a mortgage for your house, what kind of interest rate do you want? Do you want a variable interest rate, or do you want a fixed interest rate?
Right.
That's kind of it's a similar situation. Could healthcare costs go down in the future? It's possible. Are healthcare costs gonna rise in the future? That's probably more likely. So, that's just kind of like, how
I would just say, I don't disagree with either of you at all. I know something has to be done. I do not, in my particular case, take the business model approach to it, that's all. So my question for option 2 is this: is there any way, what would the numbers do if it was 20-year requirement and spouse? Because if you retire from here and you are a person who finished making $37,000 a year because you were a clerk or you were the recycling person, I mean, basically with your retirement, you're basically down below poverty level to begin with. How much of a jump does it cost if we were to at least try and keep your spouse?
You're talking about future hires?
I'm talking, yes,
Yes.
for future hires in option 2. How, does it blow your scale up at all?
It will.
It would be somewhat higher, but I don't.
Jeannie, I just have a hard time believing it in the hundreds and hundreds and hundreds and hundreds of employees that the city has had over its history.
I mean,
That there's 74 contracts.
once
It seems, so I'm trying at least to maybe try and make it a little bit better for the future people, because there are not many people who work for us that make, in the last 3 years of their 3 years before retirement, a whole heck of a lot of money. And then when you multiply it by the algebraic equation to find out what it's gonna be, and then you tax it again, I don't mean to throw my own stuff out there, but I've started to think about it 12 years out, and mine gets me, after taxes, $1,800 a month. And I have a master's degree plus 960,000 credits, and will have been teaching for 30 years. So if it's like that for me, now I have done what Mr. Heath would say we have to do. I have put money into a 401k and have done that for the past 20 years. But for the people who are making $23,000 to start, or $28,000 to start, a housing inspector starting at 34, after 30 years of experience, that's not $80,000. So my question is there any way possible we could, in any way, make it at least a little bit better for the new hires?
For their spouse.
Yeah, I don't
We
know.
have-
I mean,
we just have
I'm
to
ready to
relook at the
support
numbers.
2. I'm ready to support 2 on the recommendations of the mayor and Mr. Heath, and Mr. Boda, and you, because you haven't said anything.
Yeah, no, I haven't. I'm for option 2 also, but I'm like Jim kind of with the option of excluding the spouse. That's my thing. That's the only thing. If we could see some numbers, because you heard me say it a while ago, I said, oh Lord, the spouse is out. I mean, that's a bit much, so.
Could we
if
get that
could.
number and then get it to the council?
Yeah, no problem.
Yeah, we
So,
can get
so
the-
one, we'll do that. 2, I would guess that part of the reason that spouses, I don't know why spouses were included. I didn't write the plan. However, one of the thoughts that I had as we were going through this is as we shift to frequently 2 plus job households, spouses may be going in their individual way in
Yeah.
terms of which healthcare benefit they choose in retirement. My wife might take the board if she stays there. If I do this for 40 years, I may take whatever the city off. Yeah, I don't think I would live for 40 years if I tried to do that. But I think you know, that may be part of the reason that makes sense, but that's something we can explore, is what's the likelihood of, you know, what's happening, what are the trends today? And we should probably have some of that
And
information.
maybe even the numbers on the 74 that are retired now, you know, how many is it just the employee, how
Sure.
many is it just the spouse, and then how many is it a family? I think if we have those numbers, maybe to some extent, that could give us,
Do
an
we
idea on
have,
what
Yeah, it will.
people are doing.
yeah,
Yeah.
do we have people who come from MetLife, Lincoln Financial to meet with our employees and talk about putting money into
We have our
those
457.
retirement, right?
Yes, and they come often. Yeah, we set them up to go directly to the departments. We do it at open enrollment, and then we have several open opportunities throughout the year.
Be interesting to know,
How they,
when we have time, how many people do that? How
We
many
have
people do that?
94, I think it's 94 accounts with, and some of those are people who have left already
It's,
and haven't taken the money. But it's quite a tidy sum that's in ICMA. I want to say it's 94 accounts. And probably, I mean, they range, I have one person that's putting $16,500 in every year. Then I have other people who put, you know, a couple thousand in. I know. But there's a two-income family, no children, you know, they can afford to do that.
This is a reminder that I'm not doing enough planning for
That's me too. I'm just thinking about, I need to check this.
Like, I mean,
I'm waiting for the
It's too late
fourth quarter
for me.
statement to come in
And I
to see
just
how we
recently
did.
had someone who's getting ready to retire, but during the county's open enrollment, they went on their spouses because they knew they were going to retire. So rather than pay this price here, they're gonna go on theirs. And so there is some planning involved
Yeah.
with persons who are going
Yeah.
to retire, regardless of what level of income they're in. And some of the people who put the highest percentages of their paychecks in happen to be some of the lowest earners. Because they're the smartest
They're
about
the
getting
best.
getting that match that we put in for the 457.
There you go.
So,
All right, well, thank you, Kevin, appreciate it.
Thank you.
Thank you, Keith, thank you.
please have a safe trip back.
Yeah,
Thank you,
please.
council,
Take it
for
easy.
having
Mr. Binder, I'm sorry.
No problem.
You did good.
no,
You
you're
did a
not,
good job.
you're not sorry.
We talked to Mr.
Do you want to
Cullen
analyze a
earlier.
fire service agreement?
He's not sorry.
Yeah, really do. We could take, you wanna go back with my fire service agreement papers and come back with the actuarial?
Oh my
That was-
God.
That was Mr. Cohen in that one.
Jesus Christ.
All right, so,
Yes, we're gonna take a 2-minute
recess.
recess. But we will come right back.
You get to have recess.
Real quick, everybody's in the back.
Everybody is.
So are you all done?